Hello, and welcome to Cottage Health's Meet the Doctor webinar on healthy aging and expert insights from a geriatrician. I'm Christina Cortez, the Public Relations Manager for Cottage Health, and I will be your moderator for today. Before we begin, I'd like to review a few housekeeping items to help you get the most out of today's webinar. At the end of this webinar, we will conduct a brief question and answer session. So if you'd like to ask Dr. Wright a question at any point during the webinar, simply click the Q&A button at the bottom of your screen and type your question into the box. If you would like to enable captions during the presentation, simply click the Show Captions or CC button, which is located at the bottom of your screen. You'll find it right next to the Q&A button. And then lastly, this webinar is being recorded. A link to the recording will be emailed to you for future viewing. So it's now my pleasure to introduce Dr. Jayson Wright. He's a primary care physician at Cottage Primary Care Goleta. Dr. Wright is a Goleta native who returned to his hometown after completing his medical education. He is board certified in internal medicine and geriatrics. He earned his Doctor of Medicine degree from the University of California, Irvine School of Medicine, and completed his internal medicine residency with a primary care focus at Cedars-Sinai Medical Center, followed by a geriatrics fellowship at UCLA Medical Center. Dr. Wright's clinical interests include preventative health, dementia assessment and management, geriatric assessment, and weight management. Dr. Wright is strongly committed to community health and alleviating healthcare disparities, as well as caring for our aging community. So with that, please join me in welcoming Dr. Wright.
Thank you, Christina. I appreciate that introduction. And thank you to everybody for showing up this afternoon. I will just be sharing my slides here to get us going. So, let's see. So thank you so much for joining me. My name is Jayson Wright. As Christina said, I'm a geriatrician here with Cottage Primary Care. It's a real privilege to be able to speak with you today, not just as a physician, but as a Santa Barbara native. I grew up here, and after my medical training, it was an incredible opportunity for me to come back home to serve my community that I care so deeply about. Today, I want to have a new kind of conversation about aging. Often in medicine, we focus on treating problems after they appear. But what if we shifted that focus? What if we talked about how to proactively build a roadmap for a longer, healthier, and more vibrant life? Our goal today is to reframe how we think about aging. To help us on this journey, I'd like you all to meet someone. We'll call her Barbara from Santa Barbara. Now, Barbara is a fictional character, but her story might sound familiar. She's in her late 70s. She enjoys walking her dog at Shoreline Park and treasures her independences and the time with her friends and family. But like many of us, she has questions. She wonders, what can I do to make sure that I stay healthy and active for the next 10, 15, or even 20 years? We'll follow Barbara today as she begins to answer that question. Her story will guide us as we explore a simple but effective framework for longevity. So, how can Barbara and how can all of us begin to build this personal roadmap for longevity? Fortunately, there's a simple framework that I use in my clinical practice called the Age-Friendly Health System, and its foundation is the 4 M's. Think of the 4 M's as the 4 most important topics to regularly discuss with your doctor to ensure that your care is truly focused on you as a whole person. First, there's mobility. This is all about helping you stay active, strong, and safe on your feet so you can continue to do the things that you enjoy. Next is mentation. This focuses on keeping your mind sharp and your spirits high. It covers everything from memory and cognition to mood and emotional well-being. Third is medications. This simply means making sure that all your medicines are helping you, not unintentionally causing problems, and that you're only taking what you truly need. And the last one, which is truly the foundation for everything else, is what matters most. This ensures that your healthcare is centered around your personal life goals and values. What do you want for your health? That's what's most important, or that's the most important question that we can ask. Over the next few minutes, we'll explore each of these M's using Barbara's story to bring them to life. All right, so let's dive into our first M, which stands for mobility. When we talk about mobility, we're talking about more than just walking. It's about having the strength, balance, and confidence to move through your day safely, doing the things that you love. Let's check back in with our guide, Barbara. Remember, she loves taking her dog for walks at Shoreline Park or Douglas Family Preserve. But lately, she's felt a little unsteady on the uneven paths. She's worried about tripping and what might happen if she falls. This is a very common and very valid concern. Barbara's concern brings us directly to a key moment in your Medicare annual wellness visit. Your doctor or your nurse might ask a very simple question. Have you fallen in the past year? Why this specific question? It's because a fall is not just an accident. It can be a warning sign. It might point to an issue with balance, a medication side effect, or even change in your vision. But here's the most important reason we ask, because we can do something about it. One of the biggest myths in aging is that falling is inevitable. It's not. It's a medical issue we can address, and our goal is to prevent the next fall. So, where do we start? With building strength and balance. The good news is our community has wonderful programs designed for this. Cottage offers an award-winning program called Matter of Balance. It's a fantastic 8-session workshop specifically designed to reduce fear of falling and increase activity levels. There's also community fitness classes. So you can look for classes that focus on balance. The Goleta Valley Community Center, for example, offers functional fitness for seniors, and also which includes exercises to help with balance, mobility, and strength. Also, the Montecito Family YMCA participates in Silver Sneakers programs. And if your Medicare Advantage plan includes it, you can get free access to fitness classes specifically designed for seniors. There's also community therapists and personal trainers that can also help with maintaining your balance and mobility. And activities like Tai Chi and yoga can also be very helpful. Next, let's refine our toolkit by looking down at your feet and also your vision. So it's crucial to get an annual eye check. Our vision changes, and it's a key component of our balance. Here's a specific tip. If you wear bifocals or progressive lenses, be aware that they can distort your lower vision and increase your risk of fall due to distorting the ground. Talk to your eye doctor about a simple pair of single lens vision glasses, especially for distance or while walking outdoors. This can make a huge difference. Ensure you're hearing as well as possible. Hearing aid or hearing difficulties can lead to increased risk of falls. I recommend having your hearing screened even if you're not noticing any problems. If you're a Costco member, they do one annual free audiology screening per membership per year. You can also request a referral from your provider. People often go 10 years with true hearing loss that would benefit from hearing aids before they are evaluated. Lastly, build a solid foundation. Your shoes are your connection to the ground. A safe shoe has 3 key features: a sturdy non-slip sole, a closed back that supports your heel, and a way to secure it to your foot, like laces or Velcro. It's time to retire those floppy slippers or backless sandals for walking, even in your own home. Mobility isn't just about preventing falls. It's about staying connected to our beautiful community. A time may come when driving is no longer the safest option, but that should never lead to isolation. Here are some of the outstanding local resources that we have. EasyLift is a wonderful door-to-door transportation services for residents who can't use regular MTD bus due to either physical or cognitive disability. You do have to be certified and qualify for their services, but it can provide a vital lifeline for appointments or errands. Santa Barbara MTD is our local bus system and is very senior friendly. They offer senior passes for those 62 and over that provide unlimited rides for a low monthly fee in specific areas. They also have a new service called the MTD Wave that provides low-cost door-to-door transportation in specific zones. There's also other services in the community, such as Partners in Caring, which provides free accompanied transportation for frail or homebound seniors to get to medical appointments, and Care Connection Transport, which is a private service that specializes in wheelchair-accessible vehicles for non-emergency appointments. Finally, let's bring it all home. So most of falls happen right where we live. I encourage everyone to become a safety detective in your own home. Simple fixes make a huge difference, such as securing or removing all throw rugs, making sure hallways are well lit with night lights, and clear pathways of any clutter. Installing grab bars in the bathroom and ensuring you have good lighting on all stairs are among the most effective changes you can make to stay healthy and independent at home. If you are having recurrent falls, you can request your provider to have someone look through your home to help make suggestions. Now we've covered how to keep our bodies moving safely with mobility. Now let's move on to our next M, mentation. It might be a clinical sounding word, but it simply refers to two vital parts of our well-being, our cognitive health and how sharp our thinking is, our emotional health and mood. Let's check back in with Barbara. She's been feeling a bit more forgetful, misplacing her reading glasses more often, and she's noticed she doesn't feel as excited about her weekly book club. She asks herself, is this just normal aging or is this something more? And why don't I feel like myself lately? Barbara's question is exactly why during your annual wellness visit, we gently screen for changes in both memory and mood. We might ask you to remember 3 simple words for a minute, draw a clock, or ask questions like, over the past few weeks, have you felt down, depressed, or hopeless? We ask these questions because your mind and mood are not separate from your physical health. They're completely connected. And just like falls, changes in memory or mood are not things that you just have to accept. Feeling persistently down is not a character flaw. It may be a medical condition like depression, which we can and should treat. Let's start with talking about mood. It's completely normal to feel down or sad when something difficult is happening in your life. That's part of being human. However, if you feel persistently down, hopeless, or have lost interest in life for weeks at a time, that's a signal to seek support and discussion of treatment options with your doctor. For boosting mood and promoting overall longevity, I often recommend a non-medication prescription with 4 parts, and you can do these with a friend or partner for even greater benefit. First, moving your body. Aim for ideally at least 150 minutes of activity a week. This can be walking, swimming, biking along our beautiful waterfront, or even dancing. Get some sun. Spend 30 minutes outside each day. Even with our June gloom, the natural light is still beneficial. Connect with others. Once a week, share an activity or meal with a friend or someone who is not a family member or caregiver. Engage in a hobby. Spend time with each other on a hobby you enjoy, whether it's gardening, painting, listening to music, or even enjoying the wonderful culture that our community has to offer. Now, let's talk about cognition. It's normal to occasionally forget a name or where you might have left your keys. But what is dementia? So dementia is not a specific disease, but a general term for a decline in mental ability that's severe enough that it interferes with your daily life. It's more than simple memory loss, and it can also affect language, problem solving, and focus, which can lead to big problems such as medication overdoses or undertreatment, missed bills, major accidents, and so on. This is why we talk about it proactively. Projections show that 1 in 5 older adults here in the Santa Barbara community may develop dementia. This empowers us to open the conversation with our doctors early if we notice any significant changes in ourselves or our loved ones. Now, I want to take a moment to speak directly to those of you who are caring for a loved one with dementia. It is a journey of immense love, but it can also be incredibly challenging. Please know you're not alone, and our community has resources designated specifically for you. Cottage Health's Coastal Caregiver Resource Services offers dedicated caregiver navigator to help you find resources, as well as support groups and workshops to connect with you and others who understand. Cottage Coast Commission for Senior Citizens is our local area agency on aging, and I'll refer to it as a CSA. It's a fantastic resource. They provide assistance in finding caregiver support services, respite programs to give you a break, and information line to help you navigate any challenges that might arise. A highly recommended guide that I recommend for my patients is so it's called the 36-hour day. And it's a classic and essential guide for families that help navigating some of the difficulties that may arise with caring for a loved one with dementia. Providing engagement for your loved one and getting a bit of respite for yourself is crucial. Adult day programs offer safe, supervised, and engaging environment. One locally here is the Friendship Center with locations in both Montecito and Goleta. Montecito and Goleta is a wonderful local example of an adult day program. Also, transportation can be a difficulty with those with dementia. So I just want to briefly mention our transportation services in the community here again, such as Easy Lift, Partners in Caring, Santa Barbara Bus MTD and The Wave, and Care Connection Transport. Now, we've talked about our bodies and our minds. Now let's talk about one of the most common things we do for our health, taking medication. The goal of any medication is to help you live longer, healthier life, but as we get older and accumulate more medicines from doctors to doctors, it's possible for them to cause problems. Let's check back in on Barbara. She has her heart doctor, her primary care doctor, and her eye doctor. She takes several pills and isn't sure if they're still necessary. She also started feeling a little dizzy in the mornings and wonder if the medication might be the cause. Barbara's situation is why the so-called brown bag review is a cornerstone of your annual wellness visit or any visit with your doctor. I ask all my patients to bring in everything they take, not just prescriptions, but over-the-counter pills, vitamins, supplements, and creams. Now, a common and very fair thing that my patients often ask me is, but doctor, shouldn't you have all this in your computer system? In a perfect world, we would. But in reality, different doctors' offices and hospitals often use different systems that don't easily share information. While privacy laws like HIPAA are essential, they can often make seamless transfer of your records complicated. That's why the most reliable, up-to-date medication list is the one that you bring with you, the actual bottles in your bag. You are the ultimate source of truth for what you're actually taking at home. You have a powerful role to play in your own medication safety. Here are 2 strategies. So keeping an updated list, and if possible, try to use one pharmacy. We know there can be valid reasons why you need to use more than one pharmacy, like insurance requirements or costs. However, ideally, using a single pharmacy allows your pharmacist to be that second set of eyes, helping to spot potential interactions. If you do use multiple pharmacies, having that personal updated medication list with you is even more crucial. Also, ask questions. You're empowered to ask your doctor or pharmacist about any medication. Good questions are, do I still need to be taking this medication? Or could this be causing any of my current symptoms? Sometimes the best prescription is deprescription or safely stopping a medication that's no longer needed. To make this more concrete, I want to briefly mention a tool that we use in the geriatric medicine called the American Geriatric Society Beers Criteria, or the Beers List for short. It's not a list of bad medications. Rather, it's a list of medications that can potentially be risky for older adults because our bodies process them differently as we age. I want to highlight one very common example. The medications such as diphenhydramine or Benadryl is often found over the counter in both allergy and sleep medications. Often seen either, as I mentioned, Benadryl, Advil PM, Tylenol PM. People typically take it for allergies, or oftentimes I see people taking it for sleep. Now, the potential risk in older adults is this can often cause next day confusion. It can cause constipation, dry mouth, and significantly increase the risk of falls as well as cognitive impairment. Typically, what I recommend is before reaching for any pill for sleep, it's best to talk about it with your doctor about improving your sleep habits. For allergies, there's newer non-drowsy antihistamines that are generally safer. The most important takeaway is not to stop any medications on your own, but the goal is to empower you to ask your doctor, am I taking this for sleep, and is it the safest choice for me? So, if we know that many over-the-counter sleep aids can be risky, what is a better path forward? The goal is to address the root cause of poor sleep and not just mask it with a pill. The conversation with your provider should focus on several key areas. First being sleep hygiene. This is the foundation as it creates a strong, consistent habits for sleep, like going to bed and waking up at the same time each day, keeping your bedroom dark and cool, using the bathroom before bed, limiting alcohol use and avoiding caffeine or screen time before bed. The second can be cognitive behavioral therapy for insomnia, or CBTI for short. For chronic insomnia, the gold standard treatment is not medication, but a highly effective therapy called CBTI. It's a structured program that helps retrain your brain and body for natural restful sleep and has been shown to be just as effective as medications. Deprescribing. This means working with your doctor to create a plan to safely taper off potentially inappropriate medications that you may have been on for a long time. And then looking for safer options. If a medication is truly needed, there's often safer options out there that your provider can discuss with you. So next, another major reason why people take medications is for chronic pain. Our approach to managing pain in older adults puts safety first. So the first being start with non-pharmacological options. The foundation of pain management should always be non-medication strategies first. This includes physical therapy, gentle exercise, hot heat or ice, or considering therapies like acupuncture or massage. So when should we reach for medications, and what should we reach for first? So our first preferred medication in geriatric population is Tylenol or acetaminophen. And that's because when taken correctly and with guidance with your doctor, it really is the safest for long-term use and typically has the lowest amount of side effects. After that, typically we're recommended lowest dose of non-steroidal anti-inflammatories like ibuprofen or naproxen. A long-term risk they can have cause damage to both the stomach, leading to bleeds, kidney impairment, and also cause damage to your heart. And critically, we really strive to avoid long-term use of opiates for chronic pain. The risk of falls, confusion, constipation, and dependency are simply too high for most older adults. The goal is to partner with your doctor to build a multifaceted pain plan that improves your function and quality of life safely. Okay, so we've covered mobility, mentation, medication. We've built a fantastic toolkit for your physical and mental health, but all of these pieces are in service to our final and what's truly most important, what matters most. Instead of asking, what's the matter with you? This M asks us to consider what matters to you. It prompts us to think about what makes life meaningful and how your health can support that. Let's check back in with Barbara one last time. When she really thinks about it, what matters most to her is having the health and energy to stay independent in her own home, to continue volunteering at the Museum of Art, and to be able to fly to Colorado to see her new grandchild be born later this year. Those are her goals. They are the why behind all her health decisions. This is a true purpose of your visit with your doctor. It is our chance to ensure that your medical care that we're providing aligns with your life goals. When we ask, what are your health goals, or what's most important for you to be able to do, we're asking you to be the captain of your own ship. Your answers should guide every recommendation we make. If a new medication might make you too tired to volunteer, we need to discuss that. If a potential surgery has a long recovery that would make you miss your grandchild's birth, that's a critical piece to the puzzle. Your values should direct your care. This is where we move beyond medical problems to understanding your values. We explore options like, what gives your life worth meaning? And sometimes the toughest but most important question, what abilities are so critical to your sense of self that you would consider life to be worse than death if you were to lose them? Your honest answers to the question become our North Star, guiding all our medical recommendations. So, how do we put this into practice? It's a process called advanced care planning, and it has two main parts. First, having the conversation. Take some time to think about what you value. Then talk about it with the important people in your life. This is also when you select one person to be your healthcare decision maker, sometimes referred to as an agent or a proxy. This should be someone you trust to honor your wishes. I recommend against having a group or all family members agreeing on one outcome, because if someone disagrees with it, it can stop medical treatment until our hands are forced, oftentimes due to a worsening situation. Crucially, choosing a decision maker and telling them your wishes is a profound gift. It takes the immense burden off the shoulders of them having to guess what you would want during an already difficult time. Your decision becomes their guide. The next, documenting your wishes. There are several ways to do this. An advanced healthcare directive is the standard legal document in California for anyone over 18. This is where you name your decision maker and state your wishes. There's also other services, like 5 Wishes is another popular and legally valid document that helps you think about your personal, emotional, spiritual wishes, not just medical ones. In the clinic, oftentimes we'll do what's called a POLST, or a physician's orders for life-sustaining treatment. It's a bright pink medical form and something that you fill out with your doctor to turn your wishes into actionable medical orders. You don't have to do this planning alone. Our community has outstanding compassionate resources to help guide you. The Alliance for Living and Dying Well is a local program, part of the Visiting Nurse and Hospice Care, that is dedicated to helping people with advanced care planning. They offer free workshops and trained facilitators to help you complete your advanced directive. Hospice of Santa Barbara also offers free resources on individual counseling to help you navigate these important conversations and decisions. The CSA, or Central California Commission for Senior Citizens, assists with legal questions or assistance with these documents as well. They can also connect you to low-cost or free legal aid services in our county. And lastly, Cottage My Care patient portal. Also, we have the My Care booklet that after you've completed your advance directive, you should, or you can and should upload it to Cottage My Care. This ensures all your Cottage Health providers can easily access your wishes whenever they are needed. So, how do we put all this together into action? This isn't just about preparing for a single doctor's visit. It's about creating a proactive plan for long-term well-being and longevity. The 4Ms gives you the perfect framework. Your annual wellness visit is the ideal time to place and discuss this plan with your doctor, your partner on this journey. To make the conversation as productive as possible, you can think about first your mobility. Have you had any falls or stumbles? Are you worried about your balance? Is there anything that you've stopped doing because you're afraid of falling? Next, your mentation. Have you or your family noticed any changes in your memory? How has your mood truly been over the past few weeks? Your medications, are they all still necessary and safe? And what matters most to you? What are your most important goals for a vibrant and meaningful life? Jotting down a few notes on these topics before you see your doctor can make your next visit incredibly focused and productive. So, as we conclude, I want to leave you with a few key ideas for your journey ahead. 1, define your why, your personal goals and what brings you joy, what matters most. This is a North Star for your health and longevity. 2, invest in your future self. Take proactive steps that we discussed, such as mobility, such as exercising regularly, focusing on your mentation and medications at safety, are powerful investments to your future and your future quality of life. Use your tools. Use the 4Ms framework as a personal roadmap and your annual wellness visit power tool to navigate that path with your provider. And stay connected. A vibrant life is a connected life. Lean on your family, friends, and the wonderful resources right here that our community has to offer. And I want to say thank you so much for your attendance today. My greatest hope is that you leave here informed, encouraged, and most of all, empowered to be the leader of your own healthcare team. I'd be now happy to answer any questions that you may have.
Thank you, Dr. Wright, for that wonderful presentation. It was really informative. So now we will open the room to questions. So if you haven't already done so, please submit your questions through the Q&A box at the bottom of your screen, and I will go through the questions and read them out loud to Dr. Wright. We do have a couple of questions that came through during your presentation, so I'd like to kick us off with our first one, which is, let's see, the FDA recently approved LumiPulse test to help diagnose Alzheimer's in patients 55 and older. What are your thoughts on these emerging blood-based diagnostic tools?
So that's a great question. I had to do a quick search on the LumiPulse test because I don't know it by that name, but this is in reference to the amyloid and tau protein tests that have recently come out. Now, these are a great tool that I use in my dementia assessments. They should be done not as a screening tool, though. So when I'm looking into doing a cognitive visit for a patient, I will often use that as kind of a marker for later on if I am suspicious that Alzheimer's disease may be occurring, but not as a, hey, I'm having some concern for memory. It shouldn't be done kind of as a initial test. It really should be done after thorough testing with your provider. And the reason being is because these may be positive for various other reasons. And like I mentioned earlier, so for dementia, it really has to be after your thinking and memory has specifically caused decline in your abilities or activities of daily living, which is really your ability to take care of yourself as an individual. So these are great tools, and I use them regularly because the previous to these being out, our option was imaging. So I hope that answers your question.
Great. Thank you so much. That was a great explanation. So I believe we touched on this earlier in the presentation, but could you clarify at what age should individuals begin having their hearing checked?
So there's not a set age with regards to hearing check. Now, I typically recommend the geriatric population is really 65 or older. So I think at that age, it could be reasonable to be screened, especially if using like one of the free services like Costco has to offer. However, there's no like guideline-based routine hearing screenings like we do for cancer screenings, but I do recommend getting tested.
Okay, thank you. Our next question is about the aging parent-child relationship. As parents grow older and begin to experience those daily life effects that aging brings, what's your advice on how to initiate conversations about aging, perhaps even with a medical provider, without causing distress or taking away from the family member's agency?
That's a great question. I think really going into what matters most. So oftentimes I'm asking that question is, hey, what's most important that we talk about today, as how often I'll start my visits, but also when specifically talking about aging and kind of the long term, I like talking about what's coming up, what's important to you, and making sure that and looking for any roadblocks that might prevent an individual from being able to reach those. Now, as part of our assessments, we're going to identify areas such as recurrent falls or hearing loss, vision loss, and those sort of things that will make recommendations to navigate. So those would come up specifically. But if it's more of a global concern of, hey, mom, dad, you're getting older, I think you need a little bit of help. I think the hardest part's getting them to the doctor. But once they're there, I'm hopeful that the doctor will be able to help navigate that with you. And that will be something readily on their kind of to-do list with you.
Great, thank you for that. Our next question shifts a little bit, but what are your thoughts on intermittent fasting?
Oh, I think it's a fine thing to do. I don't have any strong recommendations for or against it. It can assist with weight loss. Now, it's the kind of mouse studies have shown that caloric restriction, there is a benefit for long life expectancy. So there is something there in that regard, but I don't have any strong opinions on intermittent fasting.
Okay, great, thank you. This question is directly for you in your career. Why did you go into gerontology?
So I actually used to work as a server here at Marvia, and I also worked at Valle Verde driving the tram, and I always enjoyed working with older individuals. I knew I was going to be coming back to Santa Barbara, and I knew that it was an aging population here. So I really wanted to set myself apart as well as be able to provide kind of the vital services that the services that a geriatrician can provide. And there's only a few of us in town here, so I really wanted to be able to have that for when I came back home.
Nice, thank you. So what should we do if some of a loved one doesn't want help and they need help and they're older?
So that can be a really difficult situation. Oftentimes when there's clear evidence that the help is needed and a person's declining it, that may be a sign of dementia that maybe has been undiagnosed up until that point. And it can get really tricky. Oftentimes people don't want to go to the doctor. People don't want to have any independence possibly taken away because they're recognizing that might be the case and that they've noticed that there's been memory changes. However, I will say that oftentimes people with true memory impairment often don't recognize it. But what to do when a loved one is having some resistance to getting medical care? It really depends on the situation. I think each one is unique and should be done in a specific nuanced way. But trying to, in the minimal side of it, trying to make a fun event out of it. So say, hey, we're going to go see the doctor, and then right after we're going to go do your favorite meal, going to your favorite restaurant, doing your favorite activity. So something along those lines. Now, if it gets to a point where you're really concerned, and you're concerned for neglect and their safety, that would be an opportunity to get adult protective services involved, which sounds a lot scarier than it is. Now, what adult protective services would do is they do an investigation. Is this person safe to be at home on their own? And do we need to get them access to resources that might help them stay in their home for as long as possible? Or do we need to do something a little bit more and have something like a conservator or having a loved one take over their care. So it's a great question, very difficult to answer because it's very nuanced, but those are kind of some of the options that might be kind of the minimum and maximum effort options there.
Okay, great, thank you. One question that comes through a couple of times, and hopefully you can answer this for everyone who may have this question, is are you considered a specialist or primary care provider? Because I think some folks are under the impression that they would need to be referred to you as a specialist.
So that's a great question. I wear both hats. So if I can be a primary care provider if you wanted to establish with me. However, if you prefer your current primary care provider and you guys have a great relationship, I can also be a consultant. So that might be if there's concern for thinking or cognition, if there's recurrent falls, or if you just want a geriatrician's perspective and to take a comprehensive look, or what's called a comprehensive geriatric assessment. Those are all services that I provide. So whether it's establishing with me directly, or I can work with your primary care doctor to help really make sure that you're as safe as possible, able to do everything you want as long as possible, and that we're not missing any medications or other issues that may want to prevent before they go awry.
Great. I think that will help many folks here. Do you suggest meditation to seniors as a tool for well-being?
I do sometimes. That will be sometimes. It depends on the individual. Oftentimes, people don't like meditation, so I really kind of gauge it on the person. Although I do think that's part of the spend 30 minutes outside per day that I recommend for kind of overall well-being. And so that can be as meditation, just sitting outside, or it can be exercising, going on a hike outdoors, or just spending time watching the ocean. So I do, but not broadly with all my patients.
Okay, great. For our next question, can you talk a little bit about osteoporosis and non-drug options? So perhaps prevention, and then if someone's diagnosed.
Sure. So osteoporosis. Now, once you're diagnosed, it's often very difficult to reverse the bone loss that's occurred without medications. However, things that you can do to maintain your bone density. So if your vitamin D is low, I'd still consider this a medication, but vitamin D, if it's low, then you would benefit from supplementing that. And the level that I like to keep my patients above is 30. Some other truly non-medication options is exercising. So resistance training, anything that's putting stress on your bones is going to help build your bone density. So things like Tai Chi, swimming, resistance training, or weightlifting are all highly recommended. And those are where getting into the local services like the YMCA and Silver Sneakers programs, or even working with a local physical trainer can be really helpful.
Great, thank you so much. Kind of in the same realm, should you have calcium, or actually no, different calcium. Should you have calcium score tests if heart disease is prevalent in your family?
So, good question. Same calcium, it is kind of the same realm, I suppose, but we're talking about so with so I often I don't offer the calcium score test kind of forthright. How I use a tool called the ASCVD tool that looks at a 10-year risk of a major heart attack or stroke, and I use that to guide the conversation with my patients. Now, most of the time, my patients are like, "Sure, that makes sense. Let's start a medication for my cholesterol," and we go over the risks and benefits. Now, sometimes people are like, "I really don't want to start one unless you have really objective evidence to say that I might have some heart disease." And that's where a calcium score test can be helpful. Because now I will say soft plaques won't always necessarily be recognized on a calcium score test, but after they've been there for a while, they start to get calcified, and that's what that score is picking up. And so if it's there, that if it helps with my patients coming to a conclusion whether or not they want to take a medication, then I will order it. But I kind of like my Alzheimer's screening labs. I don't order them out the door. It's really something in kind of nuanced situations.
Okay, thank you. How can you increase energy after the age of 70?
So I would say talk to your doctor. Make sure that there's not anything else that's possibly causing low energy. It would be the first thing. Things that you can do. So often, and I will say oftentimes too, there may be underlying mood or disorder like depression that can cause low energy. Now, the things that you can do, so other than talking to your doctor, is those items that I mentioned. So exercising regularly. I recommend 150 minutes of exerting yourself per week. So that's not just a leisurely walk. I'm talking your 150 minutes that you're breathing heavy, with a preference towards resistance or strength training. Spending 30 minutes outdoors each day. Picking up a hobby, spending time with other people, and I know it's easier said than done oftentimes with those. So I don't say that just kind of in a vacuum, but I have noticed, or I have a lot of patients that take those up and they feel much better after they do them regularly.
Awesome, great advice. Thank you. You mentioned imaging for Alzheimer's diagnosis. Can you explain a little bit more about what that looks like?
So typically we start with an MRI as kind of our baseline, and that's making sure that, because again, Alzheimer's is a specific diagnosis. So we start with an MRI as a baseline, make sure that there's nothing obvious that might be causing cognitive changes. And it really depends on the history and the exam that we do during a cognitive visit. So after we've done that, then previously what I would do is an amyloid PET scan or an FDG PET scan. And those are specific tests that can help. Amyloid PET scan is really specific to Alzheimer's disease. An FDG PET scan can help with looking into what's called frontal temporal dementia or other types of dementias and Alzheimer's disease. It helps differentiate between those. Now with those Alzheimer's labs, I'm able to get a blood draw. It's much cheaper and also much less burdensome and significantly less radiation exposure. So that's where those can be very handy. They're not quite as much of the gold standard as the amyloid PET scan. However, they're about 90% sensitive and specific.
Okay, thank you. Is there any way to definitively diagnose Parkinson's disease?
So that would be, so typically I will refer to neurology if I'm suspicious of Parkinson's disease. However, it's going to be the classic symptoms. So we look for tremors, gait issues, freezing, difficulty initiating or stopping. And then also in more severe cases, there can be cognitive changes. And there's other symptoms that we look for as well. Now, what we can use, there is imaging that can be helpful looking into Parkinson's disease, like a DAT scan is what it's called. However, I would defer to your neurologist. That's more in their realm, although it is a disease of aging. But I typically am referring to neurology for assistance in managing Parkinson's disease.
Okay, great. Thank you. That's helpful. Going back to Alzheimer's and Alzheimer's prevention, are there developments within medication for Alzheimer's? And can you share a little bit more about that?
So, commenting specifically on the treatment of Alzheimer's and not necessarily the behaviors associated with Alzheimer's, there are typically the first one that we reach for is donepezil, or Aricept is the other name. And that one can help. So now that's not going to reverse any cognitive changes that have occurred. It helps slow the progression of cognitive decline. It's and that with memantine or Namenda is the next medication that we use. So donepezil we would use in what's called mild to moderate or all stages of Alzheimer's disease, really. Alzheimer's dementia specifically. And then in more the moderate severe range, we typically will add on a medication called memantine or Namenda. The combined, they slow cognitive changes about 20% and can help a little bit with behavioral difficulties that are associated with dementia. They don't reverse, though, the cognitive changes. It's only slowing, and the medications can carry a fair amount of side effects. So it's a fairly modest effect and can have a fairly significant amount of side effects, but oftentimes I put it up to what my patient's desires are. If they don't want to take more medications, I don't push it. If they're having any significant side effects, that might be a reason why we talk about it or discontinue them. There are newer medications that work on clearing amyloid, like lenanemab and lecanemab. Now, those are a little bit controversial. In my opinion, I think that they've really demonstrated, sure, we can clear amyloid out of the brain, but it has about the similar benefit to donepezil and memantine, but carries a significant risk of stroke, whether clinically noticeable stroke or silent strokes. About 20% of patients have some form of stroke that are on those medications. So typically, I'm not recommending those newer medications for my patients. In part, they would have to go to a major center in LA and get MRIs very frequently. But I always have the conversation. If patients do bring those up, I do talk to them about it. I haven't had any patient that actually wanted to go through with those.
Okay, great, thank you. We have a lot of Alzheimer's related questions. Okay. So our next one is, if you recently had, let's say, like an MRI, PET scan for cancer or something else, can those scans be reviewed for Alzheimer changes as well? I guess if the scan is for the brain.
So if there is an MRI that's demonstrating changes with Alzheimer's, typically it's fairly progressed, or in any type of dementia, really. But they're not specific. So the specific testing would be like an amyloid PET scan or a FDG PET scans for Alzheimer's. And the FDG PET scans looking for areas of atrophy or really looking for areas of decreased activity in the brain, where a amyloid PET scan is looking for that amyloid target in the brain. Now, if an MRI was done, again, it's not specific, there might be findings that can point us towards Alzheimer's or another form of dementia. However, we would need, and I should preface, this is if we're looking to get a specific diagnosis, but we would need some kind of biomarker like amyloid PET scan or those newer labs, amyloid and p-tau labs. And I do want to quickly comment on that is oftentimes with Alzheimer's or any type of dementia, Alzheimer's being a very specific type of dementia, but there's other dementias like frontotemporal dementia, Lewy body dementia, Parkinson's, prion disease. So there's many different types of dementia. The management right now that we currently have doesn't change much despite the type, although it can be helpful as certain medications might work better and work less well in certain specific types of dementia. But it doesn't change much what kind of the treatment plans are. So sometimes people want to know, hey, I really want to know why this is occurring. And other people are like, well, it's not going to change much what I do. I'm going to make sure I'm exercising. I'm looking at another thing I wanted to comment on the fatigue questions, looking into sleep apnea as well. But I'm screened for sleep apnea. I'm treating all my medical issues. I'm eating well. I'm socializing. I'm focusing on my mental health. And those are really the kind of cornerstones that we do for treatment of cognitive impairment or dementia.
Thank you so much. All very, very informative. This is more heart related. So what is the most important thing a senior person who just had a heart attack should do to get back to normal?
Talk to your primary care and cardiologist, but so it is nuanced. So depending on the extent of heart disease, if there's any heart failure, sometimes there are specific types of physical therapy afterwards, like cardiac rehab, that can be helpful. But I would highly recommend talking to your doctor because it's very nuanced on the extent of damage that's occurred, and kind of what to get back into with regards to exercise. Other than that, making sure you're eating a healthy diet and you're taking the medications that your provider is recommending.
Okay, thank you. This one is about mobility. How important is it to be able to get in and out of a chair without using your hands?
So one of the signs for frailty is looking for the ability to stand without using your hands on the side rails of the chair. I would say if you need to use your hands to get up out of a chair, use your hands to get up out of your chair because I don't want you to fall. But oftentimes, what I'll recommend to patients is a kind of a simple workout, assuming it's safe. Is hey, while you're watching TV, do some couch stands or chair stands from your seated position, and if you're able to do it safely, assuming you're able to do it safely, just do it during the commercials, and that's an easy way to incorporate some exercise and really build your strength. Really, the concern. So, a couple of pieces of concern. If you're getting to a point where you're having trouble getting up out of a chair. That might be a sign, kind of a red flag. Hey, is there an increased risk of a fall? Can we do something about that now to help fix that? And oftentimes I'll refer my patients to either physical therapy in the clinic or even home health if they have trouble leaving their home to help work with what's called gait and balance training. And then also participating in those classes like Matter of Balance and the local gym resources that we have as well can be really helpful.
Awesome, thank you. This question has come up a couple of times. What services are offered for seniors or that you know of are available for seniors in the Santa Ynez Valley, since you touched upon some of the resources in Santa Barbara?
Now, it's a good question. I don't know offhand completely, although I do know that the Central Coast Agency on Aging would be I think where I would recommend to go first. A lot of these services, though, are still available. Not all of them are, but many of them are still available in the Santa Ynez Valley. But I would say the Central Coast Agency on Aging would be where I would point for a list of resources for your area.
And do you serve the valley?
So a great question. So I am actually at the Santa Ynez Cottage Primary Care Clinic. I do one day per month doing geriatric consults out there.
Awesome, thank you for that. Could you please repeat your recommendation about eyeglasses and fall prevention? I think it was about the distance-only glasses.
Yeah, so I always recommend my patients have a pair of monofocal or one lens glasses. And the reason being, so with bifocal glasses, you can all take yours out and look at it, and that line there can distort the ground, typically where you're taking your next step. So that often can lead to misjudging a bus step, misjudging a curb, not seeing a crack in the road, and can lead to falls. So I actually recommend people have a pair of distance glasses and a pair of reading glasses, because oftentimes we're really not out and about reading, and so having the ability to make that change. You could even have a pair of bifocals and a pair of distance glasses, but just when you're out, like out on the town, walking around, it's good to have just the one single lens so that it's not distorting the ground and increasing those risk of falls.
Thank you. Is there a dangerous level of calcium?
So you can overdose on anything, I would say. Now you would have, I would have to know a little bit more of the context of this situation. Now, if we're talking about on your labs and hypercalcemia, that's something that your provider should be looking into, because oftentimes that can be a sign of a hyperparathyroid disorder, which can lead to low bone density because that calcium is often coming from your bones. And if we're talking about supplementing calcium, I would go by what the kind of FDA recommended calcium supplementation is, which is about 1.2 or 1.2 grams per day for an adult over 70.
Okay, thank you. And what are your recommendations regarding collagen supplements?
Can you repeat that?
Sorry, your recommendation on collagen supplements?
So supplements, you'll hear me if you see me. Oftentimes for supplements, I call it expensive urine. If you're not deficient on an item, oftentimes you're just peeing it out, and they're not doing too much for you. Typically, I'll say, hey, if you're not having any side effects with these medications, then no harm in taking them. But I really leave it up to the individual. So I don't feel strongly about supplementing unless you're truly deficient.
Okay, thank you for that. At what age should someone start seeing a geriatrician?
So at age 65 is when you change from adults to geriatric designation. So at age 65 is, and really it kind of goes along hand in hand with Medicare in that regard. But age 65 is when I take people as a geriatrician and might be doing geriatrician consults. However, I'm at Cottage Primary Care. I work with all adults, so 18 and over.
Okay, thank you. Next question is, recently read about wine alcohol effects, that even one glass of wine per day is actually harmful for cognitive, physical health, especially for seniors. What are your thoughts?
I would agree with it. So alcohol is detrimental to your health, any amount of alcohol really. And I know there's been some studies that have shown wine and maybe a cardiac benefit, and those are pretty loose. So alcohol itself, and I'll say those are typically getting into different ingredients that are in the wine, but alcohol itself is toxic. So it can be detrimental to cognitive, physical health. Here in Santa Barbara, especially, wine is a big part of the community here, and being in this Central Coast, and so and that goes into what matters most. If that glass of wine per day is really important to you, I'm not going to say. Well, I might say, hey, there's a risk of drinking that, and so not necessarily helpful. Now, if somebody has truly cognitive impairment or dementia, that's where I might feel a little more strongly about, hey, really, this is a lot riskier than maybe beneficial. Now, I often am talking to my patients about non-alcoholic options. I will say the non-alcoholic beer options are actually quite good. So I often recommend those to patients. And some of the ones I like are, if you like IPAs, Athletic Brew Co. does a very nice one, and then for the lighter beers, typically any one that you go for is great. Now going on to wine, there are non-alcoholic options as well. They're okay. They're a little bit juicier of a wine, but you can try that. Oftentimes it's replacing that habit and social, just having a drink in your hand. So you can even try like teas, non-decaffeinated teas, especially if you're having them later in the day, and kind of changing that option. But wine, alcohol is a toxin to our body. So yes, I agree with it that there is some effect on cognitive, especially cognitive outcomes with alcohol use.
Great alternatives. Next question is related to neuropathy, specifically in the calves. So it causes balance issues. So what are your thoughts on working on balance when dealing with those kinds of issues?
So I think that the big part of that is really working on the balance. So making sure you're really incorporating exercise and balance training. I totally understand, though, it can be hard with neuropathy, especially if it hurts a lot. So talking to your doctor about options for the neuropathy. Unfortunately, specifically for neuropathy, a lot of the medications that are used to treat that do increase your risk of falls. But so it's always a risk benefit in that regard. With regards to balance, though, really keeping on your feet, actively working on your balance is really going to be helpful, and not just now, but also maintaining your mobility for the long term.
Thank you. Next question is, how can UTIs be prevented, and at what point does a patient ask their doctor for a culture urine?
So for UTIs, the best way to prevent UTIs is drinking enough water. So oftentimes I'm recommend now. It depends on your situation. If you have heart or renal failure, that would be go by your doctor's recommendation. But for the standard individual, drinking at least 2 liters of fluids a day. And I'm not saying just water, but fluids. But fluids meaning not alcohol doesn't count. Things that make you pee aren't going to necessarily count towards that. But with that, though, having fluid move through your urinary tract system is going to help prevent urinary tract infections. Sometimes there's anatomy or other changes that can be going on. So if you notice that you're having a lot of recurrent urinary tract infections, that might be a reason to talk to your doctor about maybe why that's occurring. With regards to the piece of when should you ask your doctor for a culture, if you're having symptoms of a urinary tract infection, I don't recommend reaching out to them on my chart asking for a culture. They really should do an evaluation to make sure that there's not something else going on. And then at that visit, they can get urine and send that in for a culture. Typically, we'll start empiric antibiotics, meaning we'll give antibiotics that are kind of our first line options when we send that culture. And then if the culture comes back resistant to that, we might switch those antibiotics to a different one.
Awesome, thank you. And then next question is, does excessive calcium intake lead to increased calcification in the coronary arteries?
No, I would say it's more from plaque buildup that over time, just being in the bloodstream, it becomes calcified. And so anything that's kind of in the body system for calcification is more of a marker that it's been there and it's been in the system. And so that's more, it's from the plaques becoming calcified, not from calcium intake.
Okay. So we're getting to the end of our session here. So I'm going to ask one last question. I'm going to tie two questions into one. So how important is nutrition in the aging process, and how can one gain weight as they age?
So how important is nutrition? So nutrition, I would say, is highly important in the aging process. So making sure you're getting enough protein per day and eating a healthy, balanced diet. Often we recommend the Mediterranean diet. And how can we gain weight as we age? Now, as we age, we undergo what's called sarcopenic weight loss, meaning that our muscles atrophy, and that often gets replaced by fat. So I don't necessarily, and each patient's an individual, so with an individual weight. So sometimes we're recommending weight loss, sometimes weight gain, but really what's most important is keeping active, maintaining that muscle mass and preventing it from turning into fat or adipose tissue, and eating enough protein and nutrients to be able to support that muscle mass. And I saw a good question. Is it okay if I answer that one as well?
Yeah, of course.
So it looks like Chris had asked another way of what's the benefit of diagnosis of dementia? Does MCI precede dementia? So the benefit of diagnosing dementia, and not so I think a few parts to this question. So there's a benefit of diagnosing the specific type of dementia because that can help guide, kind of loosely guide medication management. So like for frontotemporal dementia, things like donepezil wouldn't be recommended, but for Alzheimer's and Lewy body, that might be more helpful. For Lewy body and Parkinson's, they might benefit from like dopamine related medications. And now, so the other piece, what's the benefit of just getting a kind of umbrella term dementia? And that's essentially stating that, hey, there's been changes in your thinking or memory that have now affected your ability to take care of yourself. And these are almost, for most of the diagnoses, they're progressive, meaning they're going to get worse over time. So this is a marker of, hey, we need to make sure you're getting the support, putting in guardrails for the future, and having a plan in place so that we are proactively making decisions and you can participate in those, or the person with dementia can participate in those decisions rather than having to make emergency decisions because mom fell and was in the hospital because she was home alone and she didn't know what was going on, or leading to dad had a medication overdose because he forgot he took his pills in the morning and he took them again. So that's where having a dementia diagnosis can be helpful to help plan for the future. And then the last piece of the question, does MCI or mild cognitive impairment precede dementia? Typically, yes. Depending on what's causing the dementia, usually there's early signs. And what mild cognitive impairment is that there's changes in memory, changes in thinking, but it hasn't quite progressed to the point where it's affecting your day-to-day life or your ability to take care of yourself. Now, about 10 to 20% of people with mild cognitive impairment progress to dementia every year. So that is kind of an early warning sign that, hey, we should be watching this. And that's all I got on that.
All right. All right, Dr. Wright, well, we are at our time. So thank you so much for the presentation and for answering all of those great questions. And thank you everyone for your questions and for joining us this afternoon. Cottage Primary Care Goleta is located at 334 South Patterson Avenue, Suite 120 in Goleta. The office is open Monday through Friday from 8 a.m. to 5 p.m. However, Dr. Wright sees patients Monday through Thursday, with most geriatric assessments being booked on Mondays. Immediately following this presentation, you're going to receive a link with a link, and it's just a few simple clicks. You can view Dr. Wright's availability and schedule an appointment. We will also email a recording of this presentation in the coming days. If you have further questions or would like more information, you can always call 805-681-6424 or visit cottagehealth.org/primary care. A brief survey will appear after this webinar closes, and we'd love to hear your thoughts. Thank you again for joining, and have a happy and healthy rest of your day.